After I made a video discussing some of the best jobs for new nurses, I received comments from nursing students concerned about whether starting in a specific specialty would pigeonhole them into that track. In this video, we'll explore this idea and address whether starting in a specialty like psych nursing or OR nursing can limit your career opportunities. Truthfully, you can throw any specialty or subspecialty like aesthetic nursing into this. I just happen to talk specifically about psych nursing just because the questions I received the most were about mental health nursing. Before we dive in, if you're looking for nursing jobs, make sure to check out the job board at nursemoneytalk.com/jobs. Also, if you're a new grad, check out the new grad nurse course at nursemoneytalk.com/new nurse academy. The link is going to be on the screen and in the descriptions below. Now, let's get straight to the point. Do I think that starting in a specialty like mental health nursing will restrict you to only mental health nursing without the opportunity to transition to other specialties? No. No, I don't. I've seen nurses that started in a niche specialty and transition into a more, if you want to call it, mainstream specialty later. I believe that due to the high demand for nurses, you will have opportunities to transition out of whatever specialty you pick if that's what you want at some point. However, it's important to understand that transitioning between specialties, while it is possible, it might not be necessarily easy. While the demand for nurses is high, several factors can make the transition more or less challenging. For example, the demand for the specialty you want to move into plays a significant role. If there's a high demand for nurses in that particular area, your chances of transitioning are better. For example, if you want to move from psych nursing to emergency nursing and there's a shortage of ER nurses in your area, you might find it easier to make that switch. On the other hand, if the specialty you're aiming for is saturated with experienced nurses, it might be more challenging to get your foot in the door. The other thing that might make it more difficult to change specialties is how well your skills transfer to that new specialty. Some specialties, like OR nursing or mental health nursing, require skills that are not easily transferable to other areas. For example, I'm thinking of a psych nurse who might want to go to the ICU. Very few of the mental health nursing skills, such as patient communication and crisis intervention, will be transferable to the ICU. The technical skills required in ICU nursing, like managing ventilators and administering complex medications, are going to be pretty different. This is where you might have to bridge the gap to be successful. Here's what I mean. If you're transitioning from a specialty like psych nursing to another, you might need to take intermediary steps. For example, going from mental health nursing to ICU nursing might be difficult, so you might need to first work in med-surg nursing, then move to a step-down unit before finally transitioning to the ICU. Besides making it easier for you from like the job hunting aspect, it will also probably make the transition easier from you from just like an adjustment standpoint. My final point is the importance of networking. When trying to transition between specialties, knowing how to apply for jobs the right way is important. This often involves reaching out to your network to find connections who might know hiring managers in your desired specialty. Networking can open doors that might otherwise remain closed. For example, if you know someone who works in the ICU, they might be able to introduce you to the hiring manager or provide a recommendation. Additionally, networking can give you insights into what specific departments are looking for in candidates, helping you to tailor your application accordingly. For more information on applying to jobs the right way, check out some of my videos on how to get a nursing job, including tips on getting your first nursing job and securing a position with no experience. These videos provide detailed advice that can be incredibly helpful when navigating job transitions for these specific circumstances.